Hey there everybody, and welcome back to Healthwell. Today on our channel, we're going to be talking to you about the signs of kidney disease that you must not ignore. Kidney disease can often go undiagnosed because its symptoms can be associated with other conditions. Also, these symptoms don't typically appear until the late stages of the disease, which can make it harder to diagnose the disease early on. If you find yourself suffering from any of the signs and symptoms we're going to mention, then the best thing you can do is go and have a checkup with a healthcare professional. In this video, we're going to help you understand what signs you should be looking out for. Here are 13 signs of kidney disease that you must not ignore. Number 1. Your skin has become dry and itchy. If you're feeling itchy all over, this could possibly be a sign you have kidney disease. Healthy kidneys flush out the toxins in our blood, but if you have kidney disease, then these toxins can build up, causing you to feel itchy and have a rash. With advanced kidney disease, your kidneys will be unable to keep a good balance of nutrients and minerals in your blood. Because of this, it can lead to you developing mineral and bone disease, which will also make you feel dry and itchy. Number 2. You're having trouble sleeping. As we just talked about, kidney disease can lead to a buildup of toxins in the blood, and this can lead to difficulty with sleeping. There's a link between sleep apnea and kidney disease. Kidney disease can lead to sleep apnea because it can narrow your throat, as well as create a buildup of toxins. Sleep apnea can also be damaging for your kidneys, as it can prevent your body from getting enough oxygen. Number 3. You have blood in your urine. Blood in your urine can be a sign of different conditions, like kidney stones or an infection, but it can also be a sign of kidney disease. If your kidneys are struggling to function, they can leak out blood into your urine. Blood in your urine is never a great sign, but it can be caused by a few different issues, so make sure to get yourself checked over by a doctor. Number 4. Feeling like you need to urinate more often. Kidney disease might make you feel the urge to urinate more often. You might find that in the nighttime you're feeling an urge to urinate. When our kidney filters get damaged, this can leave us feeling like we need to go to the toilet more often. But it's important to realize that this could also be caused by a urinary tract infection, which can be cleared up fairly easily with antibiotics. A simple urine test will be able to answer this for you. Number 5. Your urine looks foamy. If you notice foam in your urine, this might be because protein is leaking from your kidneys, and this suggests that they are not functioning well. You will notice if your urine is foamy because it can take a few flushes of the toilet to get rid of it. You might also notice that your urine looks a different color to normal. It might be brown or red. As mentioned before, you could find blood in your urine, or you might notice that you're urinating in smaller amounts. Basically, if you notice a change in your urinating habits, then it's best to check if everything is okay. Number 6. You have swollen ankles and face. If you develop puffiness around your eyes, this can be a clear sign of kidney disease. This happens because your kidneys are failing to remove extra fluid in your body, and this then causes a buildup of fluid, and you may notice this puffiness around your eye area. Sodium retention can also cause this swelling to occur in your feet, ankles, legs, and hands. But this swelling in the lower part of the body can also be due to other conditions, such as heart disease, so it is best to get it checked out by a doctor. Number 7. You're experiencing muscle cramps. Muscle cramps can occur when your kidneys aren't functioning as well as they used to. This is due to an imbalance in levels of electrolytes like calcium, potassium, and sodium. The imbalance in these levels can affect the way your muscles work, which can then cause muscle cramping. You might also find that you lose sensation in parts of your body, or get a pins and needles feeling. Some people may experience restless leg syndrome, or develop muscle twitches. These are all severe symptoms in the later stages of chronic kidney disease. Number 8. You feel tired a lot. Now, you don't need to go panicking every time you feel tired, but if you're feeling weak and tired over some time, then this could be a sign of kidney disease. The buildup of toxins in your blood could make you feel like you have no energy and make it hard to concentrate on everyday life. Our kidneys, when healthy, produce a hormone that tells our body to produce red blood cells. With kidney disease, fewer red blood cells get produced, and this means that your blood won't be able to get as much oxygen to your brain, which can cause dizziness and confusion. Having kidney disease can lead to complications such as anemia, and this can also make a person experience extreme fatigue. Number 9. You're feeling breathless. When someone experiences breathlessness, they may think they are suffering from a condition like asthma, but kidney disease can also cause people to develop breathlessness. Kidney disease can cause fluid buildup, and this fluid can get into the lungs and make it difficult for you to breathe. Also, the lack of red blood cells carrying oxygen around the body can leave you feeling short of breath, as your body is not being provided with enough oxygen. Number 10. You have lost your appetite. A poor appetite can be due to many reasons, but it can also be a sign of kidney disease. A buildup of toxins can make you feel less hungry and put you off eating your meals. You might experience vomiting and nausea with the disease, and this isn't exactly going to make you feel like tucking into a big meal. By not eating as much, you might notice yourself losing weight, so weight loss can also be a sign of kidney disease. Some people with kidney disease have also noticed that some foods taste different. They have been described as having a metallic-like taste. If your food is not tasting as nice as usual, this can put you off eating and make you lose your appetite. Number 11. Your breath smells foul. The metallic taste from food can make your mouth taste different from usual, but kidney disease can also make your mouth smell. Some people call this ammonia breath. This happens when the kidneys are struggling to function and flush out toxins, such as urea, and it can cause a condition called uremia. With someone who has healthy kidneys, urea is usually released through urination, so with kidney disease, the body has to find another way to get rid of the toxin, and one way is to release it through your breath. When the urea mixes with your saliva, it causes ammonia, hence why people call it ammonia breath. This usually happens in the later stages of kidney disease, so if you notice this symptom, it's important to go and get checked out by a doctor straight away. Number 12. You're struggling to think clearly. Our brains all feel a bit foggy sometimes, but if this is happening regularly, it might be a sign of a condition such as a kidney disease. As mentioned earlier, when we talked about tiredness, kidney disease can affect the amount of oxygen that gets released to your brain. When your brain is starved of oxygen, it can be very hard to think clearly, and you may become increasingly confused. Number 13. You're feeling nauseous. Unsurprisingly, the waste buildup in your blood from kidney disease can leave you feeling nauseous, with an upset stomach and vomiting. The disease can leave your stomach inflamed, which makes it difficult to keep food down and digest properly. How can you prevent kidney disease? Well, in some cases, kidney disease cannot be prevented, but there is no harm in taking steps to try and reduce your chances of developing it. You should look after yourself by eating a healthy diet and exercising regularly. Any pre-existing conditions you have, such as diabetes, should be well managed and kept under control. If you're a smoker, then you should consider quitting, as it will reduce your risk of serious conditions. It would be beneficial to not drink too much alcohol. It's probably best to stick to the recommended limits that are provided. Finally, you should be careful to not take too many painkillers and not to take them for longer than advised. This is because by taking too many painkillers like ibuprofen, you can end up developing kidney disease. Kidney disease is a serious condition, which, as we've shown, can cause a load of health problems. If you're experiencing any of the symptoms we have talked about and you are concerned about them, then please talk to your doctor or healthcare provider. They will be able to check you over and determine what is causing your symptoms. Even if you have noticed these signs in yourself and your body, it does not mean that you necessarily have kidney disease, as these signs can be present with a lot of different conditions and infections. Are you surprised that these are all signs of kidney disease? Will you be looking out for these signs in the future? Share your answers and thoughts in the comment section below. And if you enjoyed watching this video, please subscribe and turn on the notifications so you will not miss out on any of our videos on health, wellness, and much more. See you in the next video, and thanks for watching.